Dr. Beda, let me ask you about the different procedures or the different surgeries which are needed to fix gum disease, from like a normal regular cleaning, a more advanced deep scale cleaning, I think as you call it, I'm sure it has other names, and a periodontal or gum disease surgery, a full-blown one. Shed some light on how that kind of like will work out all the way through, and when which one is needed.
Okay, great. First, we're going to start with the dental cleaning. And the definition of a cleaning helmet is basically anything from the gum line up when there's some stain, or if there's a little bit of buildup on the teeth, that's a cleaning. A cleaning never really involves anything below the gum line. So people whose gum and bone tissue are in great shape, you know, they have reads of 1s, 2s, and 3s, and really no appreciable bleeding in there, they're candidates for the once a 6-month, you know, cleaning in there, because they'll get a little stain. They'll get some particles built up in there. The teeth will dull down. A cleaning is what they need, and that's basically why and what a cleaning is for.
So not too much chicken and rotten eggs kind of like under the carpet, too far in it so that you can't reach it anymore. It's the type of stuff the toothbrush and the flossing still gets out and can reach. And a little bit more because you need to scrape the data off, but it's not hidden in there, rotting away.
Exactly. That's exactly correct. And that's what a cleaning is for. You got it.
Let me ask you something on the cleaning before we go on to the other one. For instance, you know, my dentist keeps telling me that I need a cleaning every about 3 months. And one of the reasons, it may only be one, is that I apparently have a tremendous amount of saliva, which he says is a good thing for health, except it has a, you know, negative side effect of building up more plaque. He is sometimes asking me whether I do enough brushing. Also, you know, he puts that smirky question in it. So that might be that reason that that I'm too fast with it. So, you know, why do some people, is that the reason, lots of saliva, that some people need to go every 3 months and some every 6 months, and yet some seem to be apparently having pretty good mouths even after they haven't gone for a year or two, as long as they do brush and floss, of course.
I think it gets back to the question of the thoroughness of the brushing and flossing. Once again, you know, if you can keep all of the plaque and stain buildup at bay, then, you know, you can go longer than 3 months. It's a great recommendation if it's needed, because some people will build some things up and they just need to get removed every 3 months. I'm very thorough about how I clean my teeth, and I'm a once every 3 month person myself, Helmut. So on some people it's just needed. And different conditions in the mouth and the body can cause plaque to form up a little quicker and tartar to form a little quicker than other people. It's everyone's an individual.
All right, good. Let's go on to the next stage of cleaning when there's a little bit more work to do.
Well, when you start to get buildup below the gum line and it goes into a more moderate stage of gum and bone disease, when the pocketing is 4, 5, 6 millimeters, you have some bleeding points in there, you're going to need some below the gum line cleanup. Now, in our office, it's called a soft tissue management program. And basically what it is a program wherein the patient gets all of the tartar cleaned out below the gum line. Once again, I think you called it the chicken and rotten eggs under the carpet. So we lift the carpet, get that stuff out of there, clean it just like barnacles on the bottom of the boat. Get the surfaces smooth. Along with that, there's certain medicaments that we use for desensitizing and just kind of going in there, antiviral, antibacterial agents that we flush out with, give us also as home care products, along with the Rotodent, that the patient can now start keeping things clean on their own. There are other things that could be put in if the pockets are a little deep to shrink them that are of a prescription nature called Arrestin, and that's stuff that you put right at the different sites if there's an extra heavy pocket in there. My point is that proper periodontal techniques at the stage of beginning or moderate periodontal disease are non-surgical techniques. They don't involve, cold steel and sunshine. and slicing and dicing of the tissue. And many people think, oh, I've got gum and bone disease. I can't do any surgery. On the majority of cases, if caught in time, handled properly, and the patient takes responsibility for them, surgery isn't indicated. When you're at a very advanced stage of gum and bone disease, and things have been cleaned up below the gum line, but they're still kind of going south, well, that's when gum and bone surgery can be indicated. And, I want to say that that's the final resort that most dentists and or periodontists use in trying to keep the teeth there, trying to keep them in the bone, trying to stabilize the bone as best they can. But it goes from stages from cleaning, which is gum line up, light to moderate periodontal problems, that's below the gum line cleanup. In our office, once again, a thorough soft tissue management program. And then if it's just totally hopeless, but we want to try to save some teeth, then they go on to gum and bone surgery.
All right. So let's just say a person comes in for a regular cleaning because that's what he wants to do and he knows he needs one. Whether he was at a dentist 6 months ago or whether he maybe sometimes wasn't the dentist for a while and didn't get one for a year or two. And then you determine that you need one of those deep scale cleaning, meaning you need to scrape in a little deeper, otherwise you don't get it out. And let's say the person wants to refuse it. He says, no, just give me my regular cleaning. It's better than nothing. True or not true? Is it better than nothing, or is it like, look, you've got to do it all, otherwise the chicken and the rat necks stay there, and you will be, and they'll go into your blood vessels, as we talked on other videos before, and they will infect your body. It's not all about your smelling mouth; it's about your body getting infected. So, does it help or does it not help to do a regular cleaning if you need one of those slightly more heavy ones?
Boy, that's a loaded question. And that's one of those between the rock and the hard place questions in there, because the ideal thing to do is to get the gum and bone treatment done. Will a regular cleaning help? Anything will help that removes some of the stain and some of the tartar. The thing is, with the regular cleaning helmet, it's not going to go below the gum line. So the chicken and the rotten eggs are still going to be there. The infection in the bloodstream is still going to be there. And get the idea that, I guess in our office, because we really try to educate the patients in there, I don't want them, or no dentist should have them leaving thinking that they're free from gum and bone disease because they came in for the cleaning. Will the cleaning make them look and feel a little better and take some stain and some tartar away? Absolutely. Any cleaning is better than none. Will it go in and handle the gum and bone disease? It will absolutely not do that, not to any fathom of any degree in there.
So basically, do as the doctor ordered?
As any doctor, we try to guide the patient along and educate them into the best possible decisions that they can make, based on our experience and what we know what will happen in there. Everyone's an individual. People need to make informed decisions for themselves, and that's why we try to educate them at first. So, yes, if the tissue's bleeding and there's deep pockets in there, there needs to be below the gum line cleanup and a soft tissue management program if the patient really wants to be healthy. Absolutely.
So only if you don't want to get infection all over your body and if you don't want to lose your teeth, then you should do it.
Absolutely. Yeah, exactly.
It sounds fair.
Exactly. Yeah.
All right. Well, thanks a lot again, Dr. Bedham. You're giving very good explanations here, explanations which we all can understand, I think. Bye-bye.
Okay. Take care, Helmut.